Thank you for joining us for this session, Legislative Efforts to Improve Access to Testing and Diagnostics. We'd like to thank Merck for making this session possible. OCRA is the voice for the gynecologic cancer community, engaging with policymakers to help deliver critical research funding and to ensure access to care. Joining us is Chad Ramsey, OCRA's Vice President of Policy. Chad works with policymakers on Capitol Hill and organizational allies to implement the policy agenda and achieve OCRA priorities. He also serves as staff liaison to the Congressional Ovarian Cancer Caucus and monitors efforts within federal agencies as they relate to OCRA's policy agenda. Thank you, Chad, and I will turn it over to you.
Hello, my name is Chad Ramsey. I'm Vice President of Policy for Ovarian Cancer Research Alliance. And this is a session today that we've titled Legislative Efforts to Improve Access to Genetic Testing and Diagnostics. I'm really excited that you took the time to join us today. I'm going to take you through some pieces of legislation at the federal and state level that have been introduced to address some gaps and lack of access to genetic testing. I'm going to talk about some other kinds of tests and then show you exactly what you can do to help promote access to this test moving forward. So here's our agenda for the day. And it won't take the whole day. We'll only be on here for 25, 30 minutes. So don't worry. Plus, I think you can pause these in the middle of them. So you're good to go no matter what. I'm going to talk a little bit about genetic testing and biomarker testing as it relates to ovarian cancer. Give you some of the background info on that. And then we're going to talk about some of the barriers to testing that exist for people with different types of insurance coverage across the country. I'm going to explain what advocacy efforts have been initiated, both at the state and federal level, to try to address these barriers, and show you exactly where you come in to take action to try to enact some of this important legislation. So let's jump right in. What is genetic testing as it pertains to ovarian cancer? Now, I have to tell you, I am not the expert on this. I am a policy guy. You could call me an expert on policy and on ovarian cancer related legislation, but I'm not the genetic testing expert. There's a lot of people at this conference that are a lot smarter than I am when it comes to this. So hopefully you will have had some of their sessions. But I know enough to talk about it from a policy and legislative perspective. So let's get into it. So I wanted to talk about the types of testing that are related to ovarian cancer. And generally, there are more than 4, but I want to talk about 4. These are 4 commonly used diagnostics with ovarian cancer. And on the top left, you see germline tests to detect inherited genetic mutation. And next to that is tumor biopsy tests to detect somatic or acquired mutations. Below that, in the bottom left, you have liquid biopsy tests to detect biomarkers at early stages. And then in the bottom right, multi-marker serum tests related to ovarian cancer. Now, the top 2 are what we commonly refer to as genetic testing. Both germline and somatic testing are often shorthand for genetic testing. Germline tests test your germline. They test your DNA to find inherited mutations in your bloodstream. That's types of genetic mutations that you receive since conception, that you've had with you your entire life. And it's different from somatic mutations, which are something that has occurred since you were born. They're not inherited, and they're generally tested by doing a biopsy on the tumor. A liquid biopsy test, you might have heard about Grail's Gallery test. That is a different type of test that purports to be able to find evidence of cancer floating in the bloodstream at a very early stage. Not FDA approved yet, but exciting technology to consider. And then multi-marker serum tests like the OVA1 test. OVA1 test is a type of diagnostic that can help patients who are set to go to surgery to have their mass debulked for ovarian cancer. It helps them get the stage setting just to the right way. So those are 4 types of tests, but we're going to focus on the top 2, the genetic testing, both germline and tumor testing. So why is genetic testing important? You probably already know if you're here at this session, but if you don't, or if you want to consider some other things, I have some things up here. So 20% of ovarian cancers are caused by genetic mutation. And that is a really high percentage of heritable cancer. So in fact, it may be it's one of the top 2 or 3 highest percentage of any cancer that's heritable. So that's why we talk so much about the importance of genetic testing with respect to ovarian cancer. You're much more likely to inherit this type of cancer than you are many other types of cancer. If a person learns that they have a relevant genetic mutation, their family may benefit from testing as well. So if you find out perhaps that you have a BRCA mutation, it's going to affect you, of course, but it also may affect your family. It might affect your children. And if they decide to get a mutation or decide to get genetic testing in the future because of that, that might impact the rate at which they get checkups, the rate at which they test their own levels, maybe their CA-125 levels. And it also might encourage them to engage in some sort of prophylactic activity or risk-reducing intervention. So that you can see how knowing your genetic testing status might have an impact on your family. And for those who've already been diagnosed with ovarian cancer, the National Comprehensive Cancer Network guidelines recommend both germline and somatic testing. So both the inherited cancer, the inherited potential genetic mutation, and the somatic testing. As we know, and as we find out more and more these days, the type of therapy and treatments that you receive really can be dependent upon your mutation status. If you think about PARP inhibitors, for instance, we know that they are only approved and they only work for some patients that have a particular genetic mutation status. So that's why it's so important to understand what, if any, genetic mutations you have, not only for your family, but also for your direct treatment. So, we talk a lot about what BRCA 1 and 2, and they are certainly the most common types of genetic mutations that lead to ovarian cancer. But there are others, including Lynch syndrome and others that I've listed here. And the thing is that we're finding more and more types of actionable variations, mutations, as we see additional people undergo genetic testing. And that's another really important factor as we consider expanding access to genetic testing. The more we learn about particular people's genetic mutations, the more we'll be able to keep an eye on it for future generations and figure out if there are more genetic mutations that are having an impact on the development of disease. So these are just a few that we've already identified. There are others, and I suspect that in a few years' time, that this list will be even longer. Now, as I mentioned, the NCCN guidelines for somatic and germline testing for ovarian cancer have been in place for a long time, since 2010, and that's 23 years, or 13 years. I was told there would be no math on this presentation, but 13 years ago, NCCN first published these guidelines. And despite the fact that they've been on the books for that long, we are still seeing disappointing gaps and uptake in genetic testing. So according to data that was published just last year, that looked at a series of data sources. I think there were 35 different data sources. We found that only 39% of patients were being directed to ovarian or directed to genetic counseling, and only 30% actually went through with that genetic testing. So 39% of patients, ovarian cancer patients, were recommended by their physicians to receive genetic counseling. Only 30% of those did, and the rates are even lower for Black and Asian patients. That's really disappointing, because that's an opportunity for these patients not only to understand what germline mutations they might have and the impact that it might have on their family, but also potential impact on their treatment. And we're not sure why that number is low, but we're going to look into some barriers as we keep going on in this presentation. A separate analysis found that among the patients who did receive the genetic testing, 15% of these ovarian cancer patients found actionable variants. So that's a pretty big percentage that have a potential family link to ovarian cancer. So, that's another reason why it's so important to undergo that type of testing, so that your family can potentially benefit from that information as they get treatment in the years ahead. So barriers. Why are we sitting at only 30%? Why are the rates even lower for not only Black and Asian populations, but Hispanic as well? These are really important questions. And I think, from my perspective, really put the barriers into two buckets. There's the education and awareness bucket and the cost and coverage bucket. They're sort of two elements that really can lead to difficulties in receiving these types of tests. And I want to get into a little bit more on each of these barriers and how we might be able to address them moving forward. So first off, with education and awareness barrier, I talked about the 39% that were of patients that were recommended for germline testing. Why is that number so low? Why isn't it 100%? Studies have evaluated referral patterns across specialties to determine what are their rates of referral to genetic testing, and they found that primary care family medicine, obstetrics, and gynecology had the lowest referral rates among high-risk individuals. Why is that? We're trying to understand those questions, and we're looking at more and more data, but it may require new types of education aimed at providers. I think that there is a fear of genetic discrimination. There have been some laws passed in years past that purport to protect folks against genetic discrimination, but there are gaps. There are gaps in things like long-term life insurance and other things that people are concerned about. They worry that if there is a genetic test that finds that they're higher risk for something, they may not be able to get the type of coverage that they want from an insurance perspective, and that is troubling. Lack of education about potential family impact, as we've already talked about. It can be really important for people to know their inherited germline genetic mutation status, so that they can prepare their family, to let their family know if they're at higher risk of certain types of cancer. Let their family members decide if they want to have a risk-reducing intervention, or if they want to take prophylactic action that might reduce their risk. So that's a really important element. And then implicit and explicit bias within the health systems. If we're seeing much lower rates of testing referrals to Black, Hispanic, Asian communities, why is that? Is it an inherent bias in the health system? Is it because of different places that people are receiving coverage? Is it because of the type of coverage that they have? We're looking into all those factors and trying to make some determination, but I think it's critical that we address it and we understand it better. So what are the cost and coverage barriers? We know some of the education and awareness barriers, but what are the other barriers? So patient out-of-pocket costs can vary significantly depending on coverage. We have seen the cost of genetic testing come down over the years. What used to cost several $1,000s may now cost just a couple $100s. But that test, that a couple $100s can mean the difference between getting the test or not if you're paying out of pocket. And certain patients certainly don't want to incur that type of cost, and some can't afford that. Different types of insurances cover things differently, even in the private market. Now, I have here noted that private health insurance plans generally cover some genetic testing, and the Affordable Care Act requires that BRCA testing be covered for women at no cost that have an existing mutation in their family history. But beyond that, and beyond BRCA, the coverage varies. Some don't have any coverage for that. So it might mean you're paying out of pocket to try to understand what your family history might mean to your own status from a germline inherited mutation perspective. So that's a problem. But generally, private health insurance is better than some other types of insurance. So looking at Medicaid, most Medicaid plans cover BRCA testing for those with a family history of mutation, but again, not other mutations. So Medicaid is a little bit more generous than you might think in some of these circumstances. But it does vary from state to state, and there are gaps still in the types of genetic testing that are permitted. And then Medicare is probably the most restrictive. Medicare covers only those who are already diagnosed with cancer. So if you are somebody who is at a high risk, maybe your mother has been diagnosed with ovarian cancer, Medicare will not cover your germline genetic testing to determine whether you're at higher risk for ovarian cancer. And that's troubling. That's something we want to address. And how can we address those barriers? So first, I want to talk about some state legislation that has been enacted and offered around the country for the last few years to try to broaden access for Medicaid enrollees. Then we're going to talk about some federal legislation that seeks to broaden access for Medicare enrollees, the two large government-sponsored health insurance programs. And then I'm going to touch on as well sort of administrative efforts to promote education and awareness around genetic testing. And I think another thing that we want to be able to address is the systemic changes inherent within the health system. Those challenges that people face every day in receiving equal care are something that we ought to address. We're trying to address through certain programs within the administration, but we can do a better job with that. So, state legislative efforts. A coalition of patient advocacy organizations started working together a couple of years ago to try to broaden access to genetic testing at the state level through Medicaid. As I've mentioned, Medicaid does cover BRCA testing for those with a family history, but it ought to be broadened and there ought to be more access. And you can see here's just a snippet of organizations that have worked together. This is just for the Ohio legislation that recently was considered. And you can see that it's a pretty large swath of organizations, not just cancer organizations, but really any sort of organization that might be impacted for a certain type of testing. This is really to expand biomarker testing, and I don't want people to get confused when we talk about biomarkers. A biomarker is a type of is something that can be found in your body that determines whether or not you have an enhanced risk for a certain type of disease or cancer. And there's some confusion about the way people talk about genetic testing and biomarker testing. There has been an effort to sort of get everybody on the same page with that. For our purposes, we try not to get people confused with a biomarker like CA-125 versus biomarker testing, which some refer to as genetic testing. So I don't want to create any more confusion. Maybe I just did. But what this effort is to expand access to genetic testing for several biomarkers across the states. And here's a look at states where there have been recent activity. You can see through the color-coded message, the color-coded map here, that there's been significant efforts made, and there will be significant progress made over the next 2 years. We're still waiting on Governor Hochul of New York to sign legislation that passed earlier this year. The California legislation was just enacted and signed, so we're thrilled about that. And there will be efforts in the year ahead, New Jersey and Delaware, Indiana, and a few other places that we're really hoping that we can expand this access. Most of these bills, these are all state level legislation that have to pass the state legislature, and most of them would govern both Medicaid and any other state sponsored or state controlled plans. And some of them are broader than others, but this is just a general idea of the type of work that's going on at the state level. And if you're interested, we create action alerts anytime there is an effort or an opportunity to weigh in at the state level. We create an action alert and send them out to people who sign up for them. And so I encourage you all now to go to, maybe after the presentation, or pause it now and go to okrahope.org/advocacy/how-u-can-help /. And right there, you can sign up for OCRA action alerts. And then we make it really easy for you to weigh in. You can just click on the action alert, and we'll take you to a message that's already been prepared. You can edit that message, and with one click, send it off to your elected members so that you can weigh in with them. And if you put your address in, we automatically will populate your elected officials. So it makes it really easy to weigh in, both at the state and the federal level. So I encourage you to do that. So moving on to the federal legislative efforts. Now, as we know, Congress can be a bit tricky, particularly these days. It's difficult to get them to do anything sometimes, but there have been some efforts on genetic testing. And I think that there is some real opportunity moving forward to gain some progress. So I want to talk about one or two efforts that we've engaged in. So the first is an effort that has really been spearheaded by our friends at Force to expand patient access to genetic testing for Medicare enrollees. As we talked about earlier, Medicare is really the most restrictive of all the health insurance plans out there when it comes to coverage for genetic testing. Medicare plans generally do not cover any preventative health services. That's part of their mantra. And so if you really want to have any sort of preventative health coverage, you have to get Congress to act. They've been really restrictive on genetic testing coverage. Only those already diagnosed with cancer currently have coverage. It does not allow family members to gain access to that coverage. So legislation has been introduced that would expand the coverage to those with a known hereditary cancer mutation in their family and those with a likely family history of heritable cancer. So that would really improve the situation for people who may have a link to ovarian cancer or other types of heritable cancer. It's really important to have that kind of coverage and that access, both for peace of mind and also for potential treatment decisions. The legislation would also ensure coverage for risk-reducing interventions for those with a mutation that increase their risk of developing cancer. So risk-reducing interventions, by that I mean something like a salpingectomy or an oophorectomy, where you would have your ovaries or your fallopian tubes removed surgically to minimize your risk of developing cancer. There are other types of interventions as well, but that's one that is, really effective. So, getting back to the Reducing Hereditary Cancer Act, it was introduced on March 9th of this year by a nice coalition of bipartisan members of Congress, including Debbie Wasserman Schultz, who really has been the leader on this legislation, but featuring some other members as well, both Republicans and Democrats, who've really been out front on this. And then in the Senate, it was introduced by Senator Lisa Murkowski and Ben Cardin of Alaska and Maryland, respectively. I have a picture of that, but of the legislation there. You can see that there were some other additional original co-sponsors on the House bill. So they had some good support. And here's a list of the current co-sponsors on 1526. So if you take a look at that and see if your member of Congress is on there, and if they are, you can go ahead and reach out to them and thank them for co-sponsoring, and then asking what they might be able to do to make sure this bill gets enacted. If your member is not on there, well, it's a great opportunity to reach out to them and urge them to co-sponsor the legislation. You can see that there are members from across the U.S. on there. We have a few more Democrats than Republicans, but it is a nice bipartisan effort. And we have an action alert. So if you would like to take action, there's the link right there to take action. If you want to type that into your browser or take a note and write it down, you can click on that. And it'll take you directly to the campaign, so you can send a message to your House member and urge them to co-sponsor the legislation. If they're already a co-sponsor, the message will thank them instead. So we've got two different messages out there. So it's a nice opportunity to take action on a really important legislation. Over on the Senate side, it's still just Murkowski and Cardin who have co-sponsored. So you will be able to reach out no matter where you live and urge your senators to sign on to the legislation. There's another action alert link there at the bottom. It's different from the House one. This one will focus on your senators and encourage them to co-sponsor that legislation on that side of the chamber. I'll give you a minute to take a look at that and to write it down if you wish. Not sure if those steps are the Capitol or the Supreme Court. I'm just going to pretend that they're the U.S. Capitol, because that's the most relevant to this. Okay. On the administrative side, um, the House has recently introduced legislation to reauthorize Johanna's Law. That's the Gynecologic Cancer Education and Awareness Act. And this is sort of the premier education program for ovarian cancer, for endometrial cancer, for cervical, vaginal, and vulvar cancer as well. But it's a really critical program, and this reauthorization legislation was just introduced at the end of September by Congresswoman Rosa DeLauro, who was an ovarian cancer survivor, Democrat from Connecticut, and Darrell Issa, the Republican from California. The legislation would expand the funding for this program. Currently, the program is being funded at about $12.5 million per year. This would bump that funding up significantly to $15 million per year, which would allow for more opportunity to have provider education about genetic testing, patient education as well, other sorts of efforts to promote best practices and adherence to guidelines. The CDC that administers this program has been really keen on expanding their effort to promote risk awareness. It's really important that you have these conversations with your physician about, well, my mother had breast cancer. Does that mean I'm at a higher risk? Understanding that sort of information is really critical. And CDC, through Johanna's Law, this legislation, has been making efforts to try to improve that. So we would like you to go ahead and take this action alert as well. So we got 3 action alerts for you. This one will encourage you to reach out to your members of Congress and urge them to co-sponsor HR 5834, and that's the legislation to reauthorize Johanna's Law. So that's sort of the administrative angle. And, it also, the reauthorization legislation includes sections of it that encourage CDC to focus on at-risk or underserved populations specifically. There has been an effort underway to try to understand why certain populations are enrolling in clinical trials as often, are receiving poor care, having poor outcomes, and receiving genetic testing less frequently than other populations. And to be blunt about it, it's again the Black population, Hispanic population, Asian population, the non-white population in general that are receiving poor care. And so the Johanna's Law reauthorization legislation would have CDC put a greater focus on dealing with those disparities moving forward. So not only educating, but also trying to address disparities. With that, that's the end of our presentation. I hope that you were able to take something from this, and that you'll reach out to your members of Congress with those action alerts. It's really critical that we expand access to the right kind of testing, so that folks have a better chance at identifying their disease, taking action to prevent the disease in the first place, and understanding it better for themselves and for future generations. I'm again Chad Ramsey, Vice President of Policy for Ovarian Cancer Research Alliance. If you have any questions about this presentation or anything else, please don't hesitate to email me. My email address is up on the screen, cramsey@okrahope.org. I'd love to hear from you. If you have any other comments or questions, please don't hesitate to reach out, and I will be at the conference. So if you see me, you can go ahead and poke me in the community room or whatever sorts of social engagements there are with this. I'll be around. So thanks so much, and I hope you enjoy the rest of the conference.